Okay, having to start over. Sorry, we got interrupted in the last one, but we left right here off at kidney stones. Kidney stones right here. They're going to give you the word kidney. Hopefully they give you in the definition. You start to read the definition. It says small crystals that form in the kidneys. Off the bat, you're going to think of kidneys. To me, this one's a little bit easier because small crystals, there shouldn't be anything like small crystals in your kidney, you know? Your kidneys, they can't function with things in it like that, especially small crystals. Small crystals, they're just using it as another word for stones. You know, they don't want to make it too easy, so they're going to label it the word small crystals, not stones. So off the bat, small crystals, you're going to think of stones. So stones that form in the kidneys. Off the bat, they already give you kidney stones. That's it. It's already in the definition. We're going to jump back down here to rib contusion. A blow to the rib cage that bruises the intercostal muscles. Contusion, again, you're going to think of an outside force. Compressed, like you get all these words. They label it as an outside external force. They'll label it as a compressed. Boom, they're giving you another word, a blow. They could use the word compressed. They can use the word external force. They give you blow. Then they give you the location, rib cage. Boom, it's already in the definition. They're going to say that there's a blow in the rib cage. So you're going to label it right here. Contusion, blow, rib cage. Boom, and then the rest of it, it's going to say what it does, just like the rest of the definitions do. It bruises the intercostal muscles. Boom, then we're going to jump over here. Got to pick up time. These videos are a little too long. I already apologize, Mr. Ramirez. Doing my best to try to speed up, but also show you that I know it. So we're going to jump right here to rib fracture. A broken rib bone caused by direct injury or indirect injury. Rib, off the bat, rib. Fracture. Mr. Ramirez always put it in my head. A fracture is just broken. You know, they for some reason they use the word fracture, but they can just say broken. Anything's broken when they say fracture, you know? Boom, off the bat, they already give you broken. Rib fracture, broken rib. It's already right here in the definition, you know? You just got to read the entire definition and it says it off the bat. Then it says what it's caused by. Caused by a direct injury or indirect injury. Compression. Same thing for contusion. So it just says it right here in the definition. You're going to jump right here to stitch in the side. Cramp-like pain that develops on the left or right coastal angle during hard physical activity. So this one you just kind of really have to remember that a stitch to the side is going to feel like a cramp pain right here to your side, you know? If you got, to me, I think of it as, if I had stitches on the side of my thing, would it hurt all the time? Would it feel like a cramp? In my head, I think it would. So cramp-like pain is what I look for the stitch in the side right here. And that develops on the left or right coastal angle during hard physical activity. So then it just tells you when it occurs, and it gives you a little example running. I already went over the abdomen and the thorax. I'm going to go over just a little bit of the thorax right here because I already went over the thorax. I don't want to make this super long video. Once again, I already know it's super long, so I'll go over half of this stuff. Send you screenshots of the other stuff so you know. Right here, we'll start actually at thorax because it has to do with thorax injuries. So hemothorax right here. Presence of blood within the pleural activity. Hemothorax, I automatically think of